Hello, I'm Sheila Payne, and I'm speaking on behalf of the European Association for Palliative Care. The EAPC are partners in the RESPACC project, and today I'm going to talk about what does impact and dissemination mean in the context of doing your research project. So let's think about the learning objectives for this session. I'm going to introduce the importance of identifying potential impacts of research methods, to describe a model of research dissemination, and to explain the different approaches to research dissemination. Because it's really important that when we do research, it doesn't get lost and that information is useful to other people, be they policymakers, clinicians, patients and families. So we always need to ensure that dissemination is part of our research agenda. So starting to think about 4 important questions. And dissemination should always focus on these. What is it that you want to disseminate? When do you want to do it? Why do you want to do it? And how are you going to provide information to other people about your research? Now, dissemination really should be to everyone who might use your research to improve palliative care, and that should be the reason why you're doing it. And I know that there will be other reasons, like increasing your learning or doing it as part of a course like a master's program. But really, research is about improving services and benefiting patients and families. So I'm going to give you a bit of an overview of what I'm going to talk about in this session. So I'm going to start by explaining a model of dissemination that might be useful for you. I'm going to get to grips with what I mean by dissemination and give you some examples. And some of them are what I call conventional routes that you've probably already thought about. And some of them may be more innovative. And hopefully you will also have some great ideas of how to disseminate your work. I'm going to encourage you to seek help because some people are real specialists in doing dissemination, and we can always learn from each other on how to improve our skills in this area. And I'm going to finish by offering some top tips to make sure your research really makes the impact on other people, on other services, and of course for patients and families. So this is a model of dissemination that has been developed in the Republic of Ireland. It's called an evidence-based model for the transfer and exchange of research knowledge, or MTREC. And there's a website here that would give you more information. But the model basically says, think about the message that you have, think about the stakeholders, and by that I mean the people who want to hear your message, even if they don't know yet that they want to hear it. They are likely to benefit by hearing it. Think about the local context in which you're working in. So, what's your organisational culture? How ready are people to hear the messages that you want to present? And what resources do you have available to help you present these messages in the best and most effective way? The third element really is the process issues. So remember that communication is always a transactional interaction between one or more people. So we need to think about making those processes as seamless as possible so that we effectively are giving people opportunities to learn about the findings of our research and how to interpret them in the context of the research work that they're doing in the future, or the clinical services that they might be managing, or the life experiences that patients and families might be going through as they approach the end of life. So when should you start dissemination? I think you should be planning your dissemination strategy from the outset of your research. And many grant applications now actually require a section on impact and on dissemination processes to be built into the research protocol that you will submit for funding. And certainly when I review them, that's one of the things that I look at. So do people have a plan of how they'll convey the messages about what they will find in their study? The other thing to think about is that you will have different messages at different parts or different stages of your project. So dissemination should continue throughout the project. So in the early days, you'll tell people that you've started a project, you've got X amount of euros available to run the study, and you could be very happy and pleased about that, and you say who your partners in the study are. And then later on, as you produce more findings, then you would be wanting to target particular groups who may be interested in those findings. And when your study finishes, after a year, 2, 3 or more years, there will still be a period in which you will continue to work on dissemination. It doesn't finish when you hand in your final report or your final dissertation if you're doing a higher degree. So why should I disseminate my research? And it's about creating impact. So impact can be broken down into a number of categories, but let's start with societal impact. So changes to understanding, to practice, to policy. So you might want to produce some findings on your research which are really relevant to people who work in hospices or specialist palliative care units. So you need to think about who you'll communicate them to. Is it the managers that need to know about your work, or is it the people who are delivering the service, the counsellors, the doctors and nurses? You also want to ensure that new knowledge contributes to society. So if it's a study about how people understand their bereavement experience, that's of relevance to all of us. And as a society, we have a role as researchers to communicate that as widely as possible. We also have a moral responsibility, in my view, that if we've received money from a funder, whether it's a government funding or a charitable philanthropic organisation, we have to make sure that the resources that they give us to do research are not wasted. And that not only do we make sure that the budget is run appropriately, that we tell people about our work later so that other people don't waste time repeating it, but more importantly, that services have an opportunity to learn from our work and perhaps adapt practice. So the other aspect of impact is influencing policy. So some of you may well be working on government-funded studies in your own countries. And it's important that we feed that into new government policies that better recognise the role of palliative care and are realistic in what kinds of services are required for different groups of people. The other type of impact, of course, is research impact. So we need to be honest when we communicate about our research, about things that don't go as well as we hoped or are not possible to do, so others do not repeat the same mistakes. So if your trial has a non-significant finding, that's also really important to make sure that you disseminate that. So there may be all sorts of reasons why that happens, but that is a finding as well. So it's important to tell people honestly what you did, how you did, and what worked well and what didn't work so well in your research. So all research should build on the findings of other pieces of research, and that's why you do a literature review, and we covered that earlier in this course. The other thing we need to use dissemination for is to build new theory or improve the theories that we have, and your research can contribute to that. So how can I disseminate my research? So as I've said, there's conventional routes, there's innovations, and there's seeking help. Let's look at this more carefully. So the first thing you need to do is identify what is your key message. So you might have worked really hard for the last 3 years on your study and produced a huge volume of data, but you need to synthesize that down so that there are some clear messages, and the messages are likely to be slightly different depending on who you're communicating with. So if it's a clinician, that may be about the service that you've looked at. For example, the medication that is given, the treatment for patients, the counselling that's provided. So try and think about what your key message is and summarise the findings and think about implications in 1 or 2 sentences. And by implications is, what does that mean for a service? What does it mean for a doctor or a nurse or a psychologist working in a palliative care context? What is the message that they should take? You need to help them understand your research, because most clinicians don't have time to read really long academic papers. And sometimes this is called an elevator pitch. So summarising really briefly but clearly what you found in your research is an important skill. In terms of media, the conventional ways to communicate is maybe images, and I've just given you some examples in this slide. So for some, you might want to have a diagram like a pyramid where you highlight a few things that are really important coming out of your research. It doesn't really matter what I've put in that pyramid. It's just an image, and you could use graphs, you can use box plots, you can use box charts or anything, and plots or anything that is really clear. And most people like those kind of images because they're effective and they're a good summary. You can speak at conferences, you can produce posters, and of course one of the things you will definitely be doing is writing about your study and publishing it in journals, such as this example here. So you need to think once again, is who are you communicating with? So is this a journal that is read by patients? Probably not. So how are you going to communicate with them? You might use to think about magazines or easy to read material for them. And that would be a useful thing to do. So who is your target audience? Because there's loads of people out there. How will they ever find and understand your research if you don't really target it quite specifically? And these are the sorts of groups of people that I think you may well want to be communicating with. So healthcare professionals in palliative care or in other disciplines. So you might, for example, want to be communicating with cardiologists or neurologists about some of the interesting findings that you have researched. So think about which journals do they read. You might want to communicate with other researchers for the reasons that it allows your work to be part of the platform that they build on in developing new research studies. So academics who are teaching health professionals or other people, and professionals who are policymakers and managers, people who design our services at governmental level or at regional level. They're really important, but they don't have a lot of time. So you really need to think about the implications of your research for policy. And of course, the public, patients, families, maybe people with special needs who find it hard to understand written messages. So these are conventional approaches, writing for publication. And in RESPACC, we've focused on this quite a lot. So I'm not going to spend a lot of time on this particular slide, but it's just a reminder that writing for publication is an essential part of dissemination. What about other types of publication? You might think of writing an editorial for a journal or an opinion piece, because that's a good way to highlight your research topic. For some of you, you may be writing books, but that's quite a long-term endeavour. Usually it takes 2 years or more to produce a book. Something that's much more immediate would be a blog. And this is just an example here of an EAPC blog. So the RESPACC project, we've shared some of the learning of our project through blogs, which are quite short, written in an easy-to-read style, and available on the EAPC website for free. You might want to write for newsletters. So some disciplinary groups would have newsletters, but also there may be newsletters or magazines for older people. Or you may produce project flyers, and here's an example of a project flyer from another project that I was involved in. Conferences are also really important to communicate with clinicians, with health professionals, with managers, with volunteers, with others. Select your conferences wisely. There are lots and lots of conferences. Think about those with published abstracts, because that's also a useful resource that remains in the public domain after the conference is finished. Try, if possible, to go to international conferences to highlight your work. Attend key sessions, workshops, and/or training that's offered there, so it's a good use of your time. The other thing that I think conferences are really useful for is networking opportunities. So you meet other people who are interested in the topic that you've focused on, and you share and exchange ideas. So try and meet key people, or if you're a student, perhaps other students working in your area. You need to learn to prepare a concise and interesting abstract for oral papers, for posters, for symposia. So I would encourage you to go to conferences, but think wisely about which ones to attend. So I'm going to give you a few examples now of how we've adapted material so that it meets the needs of particular groups. And in a study which was called PACE, which was Palliative Care for Older People, funded by the European Commission, we worked very closely with Alzheimer's Europe, which is an international organisation, to have workshops for people with dementia using very simple vignettes or stories so that they could start to understand and think about what it might be like to approach the end of life and offer their opinions and views on their experiences. So that's just an example of how you need to adapt things to different groups. You might also want to use images because images are a great way to get around the problems of language. So you could use informatics, artwork, photographs, sculptures or objects and be creative. And this is just a little example where we're trying to use images to illustrate particular points which don't require language alone. The other things to think about are using other non-conventional routes such as social media, although social media is very prevalent now. And I would use things like Twitter, Facebook, LinkedIn, YouTube, Instagram. There are many more that you probably will be familiar with. And this is just an example. So once again, taking the blog that we wrote on the EAPC, I would tweet it. And that means many more people will hear about it and see that the blog is available. And if they're interested, they would click on it and read it. So think about your target audience. What types of social media do they use? And try and target your messages in an appropriate way. You could also, if you have a very large project and a reasonable budget, think about producing short YouTube videos because people quite like watching videos, but they do need to be quite short, so a few minutes rather than anything too long. And we've certainly used the online platform FutureLearn to produce massive open online courses, and we've disseminated some of our European research projects through these kinds of educational opportunities, which are entirely free. And this here is just an example of a course that we ran of improving palliative care in care homes for older people, where we shared a lot of information that we had developed and tested in the PACE project. And that is then a really good way to reach clinicians who are very busy. And it provides a resource, and you can translate it into a number of different languages. So think about material that's easy to read, resources for different audiences. Make sure, if possible, that they're free and that they're available in different languages. So the MOOC, the online education that I just spoke about, we told people about the PACE Steps to Success program, which is an intervention for staff working in the care homes and their colleagues. And that was published and freely available and is now translated into about 7 different languages. We've also produced other material that is for volunteers. For example, a study that we did on volunteering and end of life. We produced an evidence-based toolkit, particularly for volunteer managers, to help them work effectively with volunteers in the hospice sector. Another project we did, which was about metaphors used by cancer patients, health professionals and others near the end of life. And we produced a metaphor menu for people living with cancer. So that's a way to talk about the cancer that they could talk to their oncologist, their nurse, their family doctor in a way that is compatible with their understanding of their disease. So, for example, for some people, they regard cancer as a journey. And here is an example which has short text which are taken from direct quotes of patients, and then we've used illustrations. So some journeys with cancer will be longer and others short, but what matters most is how we walk that journey. So that kind of expresses somebody's view of what the experience of cancer is like, and it may be helpful for health professionals to use and reflect back that kind of language when they offer advice and support to patients. So seek advice where possible. In some of your institutions, there may be media specialists who can offer you support in how to publish your work, particularly for the general public or patients and families. You could speak to journalists. I've used the word cautiously because sometimes they may take what you've done and dramatize it or change the meaning. So you do need to work carefully with them to make sure your findings are represented accurately. Consider radio or television interviews, but once again, be really clear of what your key messages are beforehand, and if possible, do some media training before you go on TV. Here are a few more tips just to end with. So dissemination is about you, your research, and your research team or group. Get a business card so that people know who you are. Dress appropriately for different events. Find out what the dress code is beforehand. Is it really smart or is it really relaxed? And that's important to help people understand that you are a credible person. Promote your research and your research team with a flyer. Remember that in many international events that most people present will be using English as a second language, and I really admire people who can speak many different languages and do so well. But in all of that, we need to make sure that our communication and our sentences are simple and easy to understand. And last thing is just a warning, not all jokes are cross-cultural, so be careful. So thank you for your attention. If you want to look at this model, there is the link here, and that may be very useful in planning your dissemination strategy. I thank the European Commission for funding the RESPACC project.